Sir, sorry, sir. No voice.
Alcohol, wine, cheese, prickle. Okay, prickle. So all these are fermented food. Fermented food, especially wine, grape wine, fermented food. So all these food they containing one chemical tyramine. Okay, this is tyramine. This tyramine doing what? This tyramine working on sympathetic system here. Here you having reuptake protein, block this reuptake protein and increase norepinephrine. Okay, increase norepinephrine. So this is the tyramine doing here, norepinephrine increase heart rate and increase blood pressure. This tyramine present, this amino enzyme present inside the liver. The tyramine present in this alcohol, grape wine, cheese, prickle or any fermented food. Okay, so patient, the monoamine oxidase enzyme break this. Understand? Monoamine oxidase enzyme break this tyramine. Breakdown done by monoamine oxidase enzyme. Patient using what? Monoamine oxidase inhibitor. Patient on therapy now. Yeah, patient for depression or patient for in case of Parkinson disease using monoamine oxidase inhibitor. If you inhibit this enzyme, clear? So what happens with tyramine? Ah, you also using alcohol, grape wine, prickle, and eating what? Monoamine oxidase inhibitor. You also taking medication, monoamine oxidase inhibitor. So all write a sentence here. All fermented food, all type of fermented food not allowed if you're using monoamine oxidase inhibitor. Okay. All fermented food like prickle, cheese, wine, alcohol, these things are not allowed. Okay. Understand? So must be contraindicated. The must explain to patient. Do not use fermented food when you taking monoamine oxidase inhibitor. If patient still using fermented food and eating the, like taking medication, monoamine oxidase inhibitor, what happen inside that patient? That patient may undergo heart attack. That patient may having hypertensive crisis. Okay, hypertensive crisis. Monoamine oxidase inhibitor. If you overuse, they also block enzyme A. If they block enzyme A, what happens? Norepinephrine high. It leads to, so what the side effect of monoamine oxidase inhibitor? Hypertensive crisis. Hypertensive crisis. These crises when happen? If patient taking fermented food. Understand? Must take care about fermented food. Clear? If you're using monoamine oxidase inhibitor in Parkinson disease patient, monoamine oxidase inhibitor type A, type B in type B patient like for type A or type B in depression as antidepressant. So with monoamine oxidase inhibitor, any type of fermented food must stop. Understand? Otherwise, what happens is all fermented food they contain tyramine. Tyramine is sympathetic system agonist, stimulates sympathetic system. Clear? It's about monoamine oxidase inhibitor, also increasing dopamine. Levodopa, done. Carbidopa, done. COMT inhibitor, now these three drugs. First we start levodopa, then we combine carbidopa, then we use CMT. These three combination you can use. Okay. Then you add on therapy. Add on therapy like you also have options monoamine oxidase B inhibitor. That's the name salicylic, resagiline, salicylic and resagiline. Okay, these two names. So these four groups done. The next group of drug, next group, dopamine group number 5. Dopamine receptor agonist. Dopamine receptor agonist. Okay. Dopamine receptor agonist. Yesterday I explained the two groups. One ergot, another non-ergot. Ergot and non-ergot. In ergot are strong agonists. Okay, ergot very strong. These are weaker, weak agonists. In ergot, very famous drug bromocriptine. Bromocriptine. Next, cabergoline. Bromocriptine have many uses, not only for Parkinson disease. Non-ergot, apomorphine, pramipixole, pramipixole, rotigotine, rotigotine. Okay, both group, what they're doing? Dopamine neuron damaging substantia nigra. Yeah. So dopamine is not coming. Dopamine here with dopamine receptor waiting for dopamine. So first we it's a dopamine receptor, it's a dopamine. Before we use what? Levodopa to increase dopamine. Before we use what? COMT inhibitor to prevent the breakdown, increase dopamine. Before we use what? Monoamine oxidase inhibitor working here, block the dopamine breakdown here and increasing release of dopamine. Actually, all these drugs are doing what? Increasing dopamine. Okay. Levodopa is a form of dopamine. We use alternative form of dopamine. COMT inhibitor block the breakdown of dopamine. Monoamine oxidase inhibitor block the breakdown of dopamine. So all these drugs they were increasing dopamine. Understand? Now another option we can directly go for stimulation of a receptor using dopamine receptor agonist. Understand? So the drug here, for example, bromocriptine, bromocriptine. Another drug, apomorphine, apomorphine. Another drug, rotigotine. It depends upon you using ergot or non-ergot. Okay. So all are dopamine receptor agonists, bromocriptine, apomorphine, rotigotine. So these drugs enter to brain and stimulate dopamine receptor. Understand? They stimulate dopamine receptor. They also use for treatment of Parkinson disease. Then they directly go into brain and stimulate dopamine receptor. So these are dopamine receptor agonists. The important thing to keep in mind is bromocriptine. This bromocriptine is a dopamine receptor agonist. Okay. So this bromocriptine, dopamine receptor agonist, this bromocriptine causing what? Another side effect. Because ergot derivative, okay? So what is ergot? If you remember microbiology, ergosterol. What is this? You know the membrane of the like cell having cholesterol. The cholesterol form in fungal membrane inside the fungus. Ergosterol, if you remember chitin, fungal wall. Okay? That ergosterol present inside the fungi. Okay, fungal wall having ergosterol. So this ergot derivative they derive from ergosterol. Understand? This drug is come from ergosterol. Ergot derivative, fungal wall. So bromocriptine and cabergoline. Bromocriptine and cabergoline, they are ergot derivatives. The other group, they're not derived from ergothitol. They are synthetic. They are synthetic. Okay, just chemically prepare these drugs. Done. So ergot derivative, they causing what? Ergot derivative, they cause pulmonary fibrosis. One problem. Ergot derivative, they causing pulmonary hypertension. Pulmonary is the main side effect. Keep in mind, pulmonary hypertension, okay, causing strong vasoconstriction, pulmonary fibrosis, and pulmonary hypertension are both derivatives. Clear? So all these drugs, this we done dopamine receptor agonist. First, we go inside the brain. Inside the brain, in the basal ganglia. In basal ganglia, you increase dopamine. If you increase dopamine in basal ganglia, if this is your aim, principle of therapy, you're treating what for this is a benefit for patient, yeah. So if you increase dopamine here, what happens? What happens? Psychosis. It's a side effect, yeah. Psychosis is the side of if you increase dopamine or if you increase if you stimulate dopamine receptor. Side effect, one side effect, okay. Second side effect, dopamine inhibit prolactin. If you remember, prolactin inhibitory hormone. What is prolactin inhibitory hormone? Dopamine. Because you increasing dopamine. So what happened with prolactin? Prolactin. So this happened inside the brain. Now move on brain stem. In the brain stem, if you remember having emetic center for vomiting, that emetic center using dopamine. So if you increase dopamine in brainstem, what happens? Number three, patient always feeling nausea and start vomiting. Clear? The dopamine outside the brain causing what? Outside the brain causing vasodilation and hypotension. Okay? Directly. And sometimes, so for example, in case of monoamine oxidase inhibitor, they increase norepinephrine. In case of CMT inhibitor, they increase norepinephrine. Okay, so they causing hypertension, hypertensive crisis, hypertensive crisis. The general idea, general concept, psychosis, prolactin decrease, nausea, vomiting. These are the main CNS side effects. Till here clear?
Yes, sir.
Any problem till now? It's very easy, yeah. Now you can treat Parkinson. It start from levodopa, add on carbidopa, okay. Then add CMT inhibitor, then change to monoamine oxidase inhibitor. These are four main groups there. Then last, dopamine receptor agonist. Dopamine receptor agonist. The dopamine receptor agonist two groups, ergot and non-ergot. Okay. Now we focus on another part of Parkinson disease. What is thinking about acetylcholine? If you decrease acetylcholine in basal ganglia, also good for Parkinson disease. Okay, also good for Parkinson disease. So, which drug you prefer? Benzalkonium. Used for Parkinson disease. Another trihexophenylate. So what are the side effects of benzotropine? Can you explain to me? Trihexophenadil and benzotropine. These are anti-muscarinic drugs. They block M3. They block M1. They block M2. What happen in eye? Mydriasis. What happen in eye? Dry eye. Dry eye, dry mouth, dry skin, no sweating, increased temperature, constipation, urinary retention. Yeah. So all are same side effect like atropine. Antimuscarinic causing dry eye, dry mouth, dry skin. Dry eye, dry mouth, dry skin. What happened with heart? Tachycardia, increased heart rate. Yeah, M2 receptor block. Understand? What happened in stomach? Decrease HCl. Yeah. What happened in intestinal motility? Blocking motility, constipation. Stop motility. So constipation. What happened? Bladder, urinary bladder contraction decrease. So because you block M3, yeah, urinary retention. So the same common side effect. Understand? So when you're using benzotropine and trihexophenadil, the same side effect like atropine. Another drug used amantadine. What is this drug? Amantadine is antiviral but also block muscarinic receptor. It's also working like anti-muscarinic. So amantadine. Amantadine. Done. So any problem with Parkinson disease? It's clear. Therapy done. Yeah. So Alzheimer disease we already done. No problem with Alzheimer disease. In Alzheimer disease, you need to increase acetyl. Yeah. So what are name of drugs? Rivastigmine, saccharine, galantamine, donepezil. Another, in addition to these drugs, we can add memantine. Memantine. So these drugs we use for Alzheimer disease. Clear? So this all about neurodegenerative diseases. Neurodegenerative disease. The next group we discuss second one, anxiolytic. And I just intro. The remaining thing we discuss tomorrow. Okay. Anxiolytic. So what happen in brain? Let me know. In frontal brain excitation. In frontal brain excitation. Okay. So how you can treat it? Increase GABA. Okay. Increase GABA. So we use drug for an anxiety, GABA related drug. Okay. GABA related drugs. So two groups, just name. Number one, benzodiazepine. Number two, just write the name, barbiturate. Okay, barbiturates and benzodiazepine. Barbiturate, benzodiazepine, they also increase GABA. Barbiturate, they also increase GABA. Okay, so these both groups help to treat an anxiety. And it is not just for an anxiety. These drugs we use for insomnia. These drugs we use to relax muscle. These drugs we use in anesthesia. These drugs we use in case of tetany. These drugs we use for muscle spasms. Many. Okay. We will explain one by one. Benzodiazepine and barbiturate. Okay. Benzodiazepine and barbiturate. These are the GABA related drugs. Okay. Till now is enough for this class. Tomorrow we will continue next slide. Okay.
Yes, sir.
So see you tomorrow, inshallah. If you have any question, you can ask me about Parkinson disease.
Besok minggu.
Assalamualaikum.
Waalaikumsalam. Thank you, sir.
Waalaikumsalam.
Thank you.
Allah
Salam
Hafiz.
warahmatullahi
See you tomorrow,
wabarakatuh.
inshallah. Allah
Allah Mister. Besok kelas.
Yo,
Motor
besok
aku.
libur.
Besok kelas besok Minggu, Joy.
Ya, ready-nya keburu keluar, bungul ready tuh.
Enggak apa sih. Serius
Aku
kelas
tadi
besok.
aku tadi ikut kelasnya Ready.
Gimana?
Aku
Aku
juga
tadi
sebentar.
masuk ya, nggak bisa tahu.
Aku dapat ilmu
Kode
baru dong.
salah. Kode salah terus.
Soalnya kau masukin yang bawah, yang linknya tuh yang atas, passwordnya we bukan yang nomor di bawah.
Ki, aku nanya besok kita emang kelas Fawad, nggak libur. Katanya Minggu libur.
Ya emang libur. Siapa ngomong nggak libur? Intinya,
Terus tadi Fawad ngomong
ya intinya besok Minggu
Fawad.
libur.
Oke.
Ada anunya kan dari anu tuh PPT kelas ready tadi.
Ini kamu masih recording loh, Ki.
Ya emang katanya kalau biar buat kenang-kenangan. Kenapa Wen?
Ada rekamannya kah?
Rekaman apa?
Anu yang kelas ready tadi.
Nggak tahu. Nggak direkam kayaknya.
Tadi aku lihat nggak ada tulisan. Tapi listening apa kan? Ready ngasih itu ngirim apa namanya?
Listening tadi teorinya.
Merah.
Kosong terbakar matahari.
Udah pakai hand sanitizer. Hand sanitizer.
Lupa aku pakai sunscreen kan buru-buru tadi subuh.
Udah bisa di mana?
Banyak lah ikannya, Ben.
Mana ada? Harus kencang.
Iya di sini hujan tau, Wen.
Kau
Kacamata
nanti
aku dah.
jangan hidup di tempat lain kecuali di pinggir pantai, Ben. Kau nanti bisa depresi.
Iya.
Tempat-
Misal aku hidup di Nunukan, coba aku lahir di Lombok kah?
Di Bali. Aku mulai di Bali.
Selancar. Jangan di Bali. Bali itu penuh dengan hedonisme.
Enak loh kalau di Bali tuh.
Hedon di Bali tuh.
Belum pernah ke Bali.
Ayo sini ke Bali. Ayo sini
Nggak
ke
ada
Bali.
Iya
Orang
lu
aja
kalau
ngomongnya.
lu
Kalau Derawan ada anunya Yul, travelnya Yul.
Oh, mantap memang.
Aku tadi coba cek tiket pesawat. Biasanya kan aku cek hampir 2 kali sehari ngecek harga tiket. Terus
Astaga,
yang
kasihannya kawan.
mending kau lihat tuh loh, ada nilai ajaib udah keluar clinical practice kita nggak tiba-tiba bisa ada nilainya itu maksudnya apa coba?
Bagus kan nilainya? Maksudnya
Lihatlah
bagus
punyamu
ya?
sendiri. Orang
Ntar aku minta tolong lihat ya.
kita nggak ngapa-ngapain kok tiba ada nilainya tuh loh.
Nggak tahu. Nggak lihat, aku lihat punyamu tadi pengumuman itu.
Mungkin kita
Ya
perlu
itulah.
anu kali ya, buat kayak apa ya, semacam nggak surat sih, apa sih? Kayak
Surat apa?
anu gitulah.
Perjanjian.
Kayak bentuk pernyataan sikap mengevaluasi anu ini. Minta jangan, maksudku mauku tuh anu mending nggak apa-apa lah ditunda praktek itu.
Iya loh,
Nggak
mending
apa-apa
ditunda
daripada
online.
daripada online.
banget greget tahu sumpah.
kita praktek masih apa? Praktek pakai baju tuh doang.
Pakai baju ada prakteknya. Maksudnya bukan baju itu ya kawan, sorry.
Tapi loh yang kayak rehabilitasi kemarin tuh lumayan sebenarnya yang Lause yang ngasih video yang yang cowok, cuman suaranya nggak jelas kan. Itu sebenarnya kalau suaranya jelas
Jauh.
itu sebenarnya ya praktek ya nggak apa-apa kalau kayak gitu. Cuman ya karena suaranya aja kemarin. Di Cina ini nggak ada kayak Google Drive itu dah.
Nggak tahu ada, nggak tahu. QQ itu sudah.
Google Drive gitu loh. Jadi kan kalau video kayak Lause kayak gitu kan mesti alasannya panjang-panjang nggak bisa dikirim. Kayaknya nggak ada ya.
Iya ada.
Ada lah.
Enggak, aku bingungnya Lause itu
Adalah.
ngambil video YouTube itu dari mana loh?
Video
VPN.
YouTube di itu.
Nggak
Video
gitu
YouTube.
dia. Yoku udah
Anu,
ngambil.
bukan Yoku, ada satunya.
Di
Apa
Weibo,
namanya?
IG.
Bukan. Apa ya? Kayak YouTube juga. Persis
Banyak ya
kayak
kalau di
YouTube.
Cina. Banyak
Apa
aplikasinya kalau
namanya?
masalah video.
Losan. Hah?
Banyak aplikasi kalau yang video-video gitu ya kalau di Cina.
Tapi jengkelnya tuh aplikasi Cina tuh minta KTP, Wak, Mas.
Jadi nggak bisa.
Nah, semuanya nah semuanya provide internasional.
Iya. Ya itu yang katanya negara yang bagus tuh kayak gitu.
Di kampus itu kan kayak event-event itu ada aplikasinya rupanya. Pas aku register minta KTP ya.
Oh ya Tip, buka kamera aku mau lihat mukamu sekarang Tip.
Jangan, gosong.
Mongas.
Oh ya Tip.
Ini nggak mati kan nih? Kurang berapa menit ini?
Lebih 10 menit soalnya masih biasanya ada tulisannya, ini masih belum. Tapi ini bedanya masih ke record.
Masih ke record.
Katanya kalau beli buat kenang-kenangan.
Aduh.
Bener loh guys, kayak kenangan banget. Masanya seumur-umur tuh kayak baru sekali ini ada kegiatan serba virtual. 10-20 tahun lagi baru kerasa kenangannya.
Bayangin dulu ya gimana kalau pandemi ini ada sebelum internet. Gimana? Libur mahasiswa total, libur total.
Yang banyak meninggal dulu tuh pandemi apa tuh?
Yang
Pasti nggak ada sekolah.
flu Spanyol
burung.
loh.
Oh ya, Spanyol juga.
Flu burung, flu babi kan nggak sampai pandemi.
Ini bisa jadi alasan nggak kita ntar ya pas kita
Yang
koas
baru.
atau apa nggak tahu jawaban terus kita bilang corona
Kata Bang Aryo jadikan alasan.
Siapa?
Ya benar bro, tapi terkadang sesuatu yang mendesak itu akan menghasilkan alasan.
Bilang Mas Aryo kan kalau adaptasi di Indonesia jangan jadikan alasan apa language barrier-mu pas di Cina.
Ya jangan lanjut barrier, kita memanfaatkan corona cuy.
Menghadapi
Wow.
pasien. Sorry, ini penyakit Anda pas chapternya pas corona.
Jadi kita nggak bisa lihat pasien langsung. Sorry.
Pasien kita nanti virtual juga.
Di download.
Ya lagi yang suka mau makan malam dulu.
Tadi suara
Oh, ngapain
keluar
ya?
kayak.
Nggak ada mana ada suara
Aku
Randy?
di chat pribadi Mr. Pawat stop.
Oh iya, awal-awal tadi itu animemu.
Kalian
anime
sudah
kan?
kumit loh. Kok ada masuk
Iya.
suara?
Masih awal-awal itu tadi tapi.
Oh mungkin
Kan
apa?
belum lihat.
Makanya aku kadang kalau masuk Zoom masuk apa itu kalau ada mutar YouTube aku matiin dulu. Takut.
Iya, kumute semua. Tapi kok
Tapi
ada
loh, udah aku itu
Videonya matiin,
sebenarnya.
bukan mute-nya. Videonya matiin, video YouTube-nya.
Udah aku itu tadi kayak apa masuk mute semua kayak gitu sih tadi pengaturannya.
Iya,
Cuma tadi aku lupa
Awal
itu.
aku masuk tadi
Biasanya itu kan nggak usah apa namanya join apa accept host gitu kan. Tadi tuh lupa aku jadinya
iya.
tunggu satu-satu aku.
Nggak
Lupa.
mau kok
Nah, ini baru kurang 10 menit dah. Ya udah selesai.
Kirim link, tapi ngomong ngirim link video, Ge. Ya, yang kita aja kan, nggak seluruh.
Video apa?
Video ini yang recording ini.
Kalau kau tuh butuh, itu kau chat pribadi aku, nggak usah ngomong gitu loh, Bib. Semua itu dipermudah,
Karena
jangan
kalau teman-teman yang
dipersulit.
butuh juga chat pribadi kan, tapi jangan
kita bikin TikTok virtual yuk.
Tadi berapa orang total 15? Soalnya kan kalau misalnya udah dibagi
16 Kak. Oh, 16 sama Pawat ya.
Kok sedikit ya? Biasanya sampai 19 tau.
Malam Minggu.
Oh ya, malam minggu ya? Aduh, aku semenjak kuliah tuh udah nggak tahu malam minggu tuh kayak udah nggak kayak waktu SMA.
Hai.
Aku masih hafal malam Minggu karena mancing.
Lihat malam minggunya mancing sekarang.
Besok mau berenang dulu dah. Berenang yuk.
Ini nggak kapuk ini orang ini.
Tahu. Besok
Berenang
kita
besok,
kalau
enggak
ketemu. Kita harus jaga jarak sama Biba besok ini kalau ketemu ini.
Besok ketemu.
Besok.
Aku nggak kena di kolam renang, so sorry ya. Kolam renang aman.
Kira
Iya,
nyam.
Ya udah ya. Selamat malam.